And there are definitely a lot of families that I text
Yeah.
regularly, that I email, that I call, that I think about their kids for years afterwards. And those parents know who they are. I do that all the time. And I think a lot of pediatric ENTs do because we sometimes meet these babies in the NICU as tiny preemies on ventilators, and then we follow them until they're like 15 years old.
Yeah.
They've graduated from the vent, then they have a trach, then they've graduated from the trach. We've done so many different things.
I saw it at the hand washing station at the entrance of the NICU. I see it in the playroom during medical play bingo. I see it near the fish tank in the surgery waiting room. There is a powerful unspoken language between two parents who have never met, but know in their deepest soul what the inside of a children's hospital feels like. It is joy and it is grief. It is love and it is fear. It is miracles and it is loss. This podcast exists to tell these stories. I'm Katie Taylor, a very proud child life specialist, and it is my honor to be your host of Inside the Children's Hospital. Hello, my friends. I'm so happy to be with you today. Okay, quick question for all the parents who are listening. Have you ever walked into your child's medical appointment feeling like, I need to advocate for my child, but I don't want to come across as difficult? That tension is exactly what we're talking about today. I'm joined by Dr. Tali Lando. She's a pediatric ENT surgeon and mom. And this conversation, we take a good, honest look about what it actually takes to build trust between families and providers. We talk about how to share your child's story without feeling like you have to say everything, how to prepare your child for surgery in a way that actually helps, and what providers are actually looking for when it comes to a partnership with parents. And what I love most about this is Dr. Lando pulls back the curtain on the human side of medicine and what it actually feels like on her end as a provider, and how powerful it can be when parents and providers truly work together. If you've ever felt unsure about how to advocate and collaborate at the same time, this episode is for you. Let's get started. Dr. Tali Lando, thank you so much for being with us today. Would you share a little bit just about yourself, where you come from, your background, your drive to become an ENT surgeon, and a little bit about what you do now?
100%. So thank you so much for having me. I'm really excited. I grew up in a small town in Pennsylvania, but basically I'm a New Yorker after that. And I always wanted to go into medicine since I was pretty young. And I don't have any doctors in my family. So I think it was just actually that I have three brothers and none of them were going into it. So I wanted to do something different than them. But I just, there are people that walk into a hospital and hate it and want to get the hell out of there as soon as possible. And
Yeah.
then there are people like me who just want to be there all the time. And I felt that way, I don't know, since I was in seventh grade. Like the first time I stepped foot in a hospital, it just felt like my safe space and a comforting space. So I
Yeah.
think that that's like a divide that maybe starts really early with like going into medicine or healthcare. Um, Fast forwarding all the way through that, I go to college, I go to medical school, all in Manhattan, and then I want to be a surgeon, but I want to be a surgeon with a big part of my day big part of my week and my career that's very clinical and have relationships with patients. So then you typically choose a surgical subspecialty that has a very office based and also an OR based, balance. And ENT is one of those. And I just always loved kids. I knew I wanted to be in the pediatric end of things. I think adults can be like yucky with all their stuff, and with kids, they're like adorable and they can be screaming their heads off and be crazy, not wanting you to do whatever you need to do to figure them out. But at the same time, they can also be amazing and you just want to advocate for them. I loved the interactions with families, although we'll talk more about like how that can be challenging and rewarding. But
Yeah.
again, all that stuff either kind of appeals to you or scares the crap out of you. And if it appeals to you, you go down the pediatric subspecialty road.
Yeah.
And now currently so basically I did a 5-year residency in ENT. That's what you need to do for training. And then I decided to do a 2-year pediatric airway fellowship at the Children's Hospital of Philadelphia to really get like super subspecialty training. And now I live in Westchester, New York. I have 3 teenage daughters, age 12, 14 and 16. So I am in the thick of it, as you can imagine.
Yes.
And I have two dogs who are also girls, and my poor husband is very outnumbered. I have a golden doodle and a Cavapoo.
I can just imagine, like, even just getting to chat with you now, how warm not only the patients and families, but the staff who work with you feel. I've gotten to follow you a little bit on Instagram, and I love your stories. I love vibe. I love how you show up as you, and you take
My
that
daughters would call that cringy.
cringe 1,000%.
They're
Yes.
just like, you know how embarrassing it is, but yet my friends think you're cool?
You're like, fine, then just listen to your friends. They're
It's
right
good
one of
enough.
these
It's good
times.
enough. Yeah.
Yes. Well, I was so excited to chat with you for a few reasons. One is that you kind of spoke to this a little bit, but when you treat a pediatric patient, it's not just the child, you're treating the entire family. And here on this podcast, we love a squeaky wheel parent, and especially the parents of medically complex kids who think they have that sticky note that's on the chart that says, "This mom is a lot." By the way, that totally dates me as how far back I go to charting when we had physical charts and it wasn't the
Right.
electronic health record. But these parents we know are really just strong advocates and love to be partners with the care team most of the time. They've been through some stuff with their kids. How do you find yourself moving from a very surface level, doctor patient family relationship to a very deep collaborative one, knowing you have so many patients and so little time?
So I really love getting into it with the families. I actually do care about the backstory, and but there's limited time. So it's a big
Yeah.
balance, right? So the first time I really try to understand the dynamics of a family, because that I think sometimes 80% of my job is psychology and 20% is the medicine, and maybe 5%, if you've been doing it as long as me, is the decision making, because you just have so much that you know already. I really individualize my care based on each kid. So I do care about the backstory, and I want families to know that I want to hear it. But I think the way that families can really advocate for their kid in an effective way is is like you said, kind of presenting it as a partnership rather than I'm the only one who knows my kid and defensive. Because
Mm.
I think the only negative interactions that I've had with families where it kind of goes down a bad road is when I get this feeling that they're trying to protect the child against the doctor. Now,
Yeah.
usually that comes from negative experiences in the past or times when they have said something is wrong with my child again and
Yes.
again and again, and they've been ignored. So they feel like, they're fighting, 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 and the fight doesn't calm down even when somebody acknowledges them.
Yeah.
So it's I get that you're an advocate, but when you're on the physician side, the ones that I get super connected with, and then you do go the extra mile for those patients. I mean, you have your favorite families and favorite patients, and a lot of it is because they respect you. They see that you're listening, which isn't always about how much time you spend, but how you process what they say. Like,
Mm.
I process fast. I really have been paying attention to the psychology of parents and kids for a long time. So you can tell me I'm going to listen. I'm going to get the picture. I might not have every single detail, but
Yeah.
that doesn't necessarily mean that I have 45 minutes to talk about your child, because realistically when you're a super specialist, there's just a lot of people banging on your door.
Yeah.
So it's like, see me as a partner if you're connecting with that person. If you're not connecting, it's not the right person for you. But
Yeah.
once you're like, I trust this person, I hear that they're listening to me, then you got to let your guard down a little bit as a parent and not like, again, be like, someone might still be harming my child. If you're past that point where you're in, danger mode, right?
Yeah.
And there are definitely a lot of families that I text
Yeah.
regularly, that I email, that I call, that I think about their kids for years afterwards, and those parents know who they are. I do that all the time, and I think a lot of pediatric ENTs do, because we sometimes meet these babies in the NICU as tiny preemies on ventilators, and then we follow them until they're like 15 years old. They've graduated from the vent. then they have a trach, then they've graduated from the trach. We've done so many different things. And, two, if you follow my social media, there are two patients. I would never do this without the parents doing it first, but they posted, look, my daughter's the inspiration for this chapter. So some of those are patients that I have, I get Halloween pictures from. Like and I know like their nicknames. I know what like their stuffies look like. So and a lot of that is because the families are, again, they're grateful, they're respectful, even though they know and I've acknowledged that they know their child the best. And I think that, you don't need to you do have to pare down a little bit of the binder when you're talking to a super specialist. If you tell them every single detail of the tapestry of this complex story that led you to their office, it's a little bit going to be overwhelming. So
Yeah.
try to tailor what you're presenting to that specialist to like what's relevant to them. There's a limit. Because then I'm going to be able to listen, retain, give back without all the time going by with just the
Yeah.
explanation.
Yeah. That makes a lot of sense. And it's just kind of that age old tale of you're going to get way further with honey than you are vinegar.
Right.
And, I think it's okay for parents to open up at the beginning and say, I hope I'm not coming across rude. I've been burned in the past. We've tried to get this appointment with you for 6 months.
Exactly.
So please just know that's how I'm coming in here, but I want to partner with you to get the best
Mhm.
care for my child. It kind of just levels the playing field of like, okay, you're like, I know this mom has or dad has been through a lot. Um, I'm not going to take it too mercifully, but like, let's work together on the best thing. And then I guess when they do finally get that time with you, how do they pare down that binder to finally seeing you when they just want so desperately for you to know so much? What
I
where are the
think the
most
best
productive
thing is
conversations?
start with like, why did you come in? Like, what is the problem we're trying to solve? Because I might not be able to solve all of it.
Okay.
And then I will ask some of the questions that might lead to the context, so I think, again, not every visit can be the comprehensive solution to every single problem. And if your child has, let's say it's sleep apnea, and really the reason that you've been trying to get in touch with me and get into my office so badly is that your child's sleep is so terrible. It is negatively affecting their function during the day. They're struggling in school, they're struggling with behaviors. So let's focus on that problem.
Okay.
And you might not have time in that moment to get to every single other problem that's in the binder or the backstory. It could be relevant. I might ask you questions about feeding and swallowing, which might lead you to tell me about their RFID or their food aversion or something else that's relevant. But I
Okay.
think sometimes when a parent, starts telling me a story that goes in many, many different directions, my redirection is like, tell me what triggered you to make this appointment with me, because then I can really understand what we want to tackle first.
Great. I love that. I love a problem solution starting out the conversation because then I think you both leave with expectations that this is the problem we're going to tackle today.
Remember that you can have follow-up conversations, potentially a telehealth, not in front of the child. There are mechanisms of getting deeper into, let's say, psychological stuff with the child that you might not want to talk about in front of the child, but you just be fair to the physician and just say, okay, I want to tell them so much more. But maybe it's not going to be right at that moment. It could be another visit, or it might even be able to be a scheduled telephone conversation. That really helps me.
Hmm. That's great advice. I also love the message capability in a portal afterwards. And if
Hmm.
you're like, oh, I forgot to mention XYZ, just a quick note over, because we know sometimes parents are be so excited to finally get in front of you that they can forget one really important detail that they had promised themselves they would say.
Of
I think
course. And
that's,
then you could just add that to the medical chart. It doesn't necessitate always a callback and another
yeah,
conversation. If it's just like, oh, I forgot to mention we have a family history of a bleeding disorder, which I forgot in the heat of the moment. These are
yeah,
really important things I need to know.
yeah. Absolutely. Talk to us a little bit about your purpose in writing the book. And then I don't want to get too far away from that because I can just see how much you care about your patients. And then that's the reason that you're in this. And as a child life specialist who worked in surgery before, I've prepared and supported countless kids for their tonsil and adenoid procedure.
Yes.
It's very common, very routine for the care team, for the providers, but very disruptive to the child's life and to the parent's life. And it's not just a one-day surgery. What are some of the things you tell families before that surgery that really help you see have better outcomes for the child?
I'm going to start with the second question first. Okay.
Yeah.
So I do have a really strong opinion about this, which is
Okay.
you have to know your child. So some children who are very anxious, but more information will just stress them out, either because they're too young or just a simple plan will help them. You don't over prepare. Okay, so I can't know your child to the degree to know should we over prepare them with every detail so they know what's going to happen that morning going to the hospital, or should we just tell them the truth but not, you know, burden them with all the details. And so highly anxious kids are the ones that you really have to worry about. We'll talk about each of those, but let's say you don't have a highly anxious kid. You just have the kind of typical kid. I don't think they need to know so much, but they need to know the truth. Don't ever say to your child, "We're just going to visit grandma today. That's why you're not going to school." I have seen parents come in and the kid doesn't know they're coming to the hospital and they don't know they're having a procedure. I don't think that's ever a good idea. If your child is so anxious that they couldn't know that piece of information, we need to do something
Yeah.
like maybe a relaxing medicine that the pediatrician will prescribe. This is very rare, but I'm saying if it's that extreme,
Yeah.
that's going to decrease anxiety to get them in the door. But most children, you can say, "We're going to go see Dr. Lando again. We're going to take care of this problem you're having." They might want to know, "We're going to fall asleep with the mask to breathe." And if they use a nebulizer at home, it's very easy to say, "Just like your machine at home," because that will prepare them not to feel like they're being suffocated or scared, or like a space mask to fall asleep, something simple like that. You know your child and you know that like a book about going to get your tonsils removed is going to resonate with them because they are a kid that loves to have knowledge that prepares them. And you
Yeah.
have to leave your anxiety at the door because if you are anxious, they are going to be 10 times more anxious.
Mm. Yeah, absolutely. It's I resonate a lot with what you're saying. I think preparing kids based on their age and developmental level is extremely important. And what is the need to know? Like the need to know is we're going to hop in the car, we're going to go see Dr. Lando. Let's bring your bag of stuff that we can bring. And when we get there, you're going to change into some hospital
Yes,
pajamas. Very simple, very
exactly.
need to know. And then the next step, how did they do with that information that you just share with them? Did that freak them out? Well, if that freaks them out, then we know, okay, let's just do need to know in the
Right.
moment. If they start asking more questions, you know this, kids are so great. When they want to know the answer to something, they're going to ask the question. If they're
Yep.
not ready to hear it, then they're not doing it. It reminds me of my son. He's been asking about Santa constantly. He's 10. And I had told him, I said, look, I will be honest with you about Santa, but you can't ask me at nighttime. And then, you can't ask me right before bed because I don't want you to be thinking about it all night. So finally, he heard me 2 p.m. one day. He's like, hey, mom, get in here. I want to know because he was ready to receive the information. That's a very, very not, it's just a silly example of, well, why are we going to see Dr. Lando? Remember, she takes care of your throat. This is where she works when she's not at the clinic. You can answer honestly, like you're saying, and give them information that they need to know. Do we need to know the name of the tool that you're using to take out the
Right.
tonsils? No, probably not. But I do like, the aftercare for me is so much of what makes the outcomes better or worse for kids after these surgeries. Are they taking their medicine? Are we getting our popsicles ahead of time? How do you navigate that aftercare with families?
So again, it's very age dependent. So the little kids, you make it all about the popsicles and the ice cream and filling the freezer. Like, you give them something to look forward to. It doesn't mean it's going to hurt less. It just means there's this like positive association with the process that
Yeah.
they got a freezer filled with their favorite things.
Yeah.
And so that even when we're talking about, right before the surgery happens, like, while they're falling asleep, I usually am like, asking them what flavor ice cream do you have waiting for you? What's your favorite popsicle? And then they have it at the ready and they know it's like in the freezer. They're going to alternate Tylenol and Motrin. They're going to have to do that. Now, for teenagers, it's the total opposite. I'm giving the two extremes. I am very honest with them because they have to understand what they're going through or they feel very betrayed. So with the teenagers, also because their reality is different for how they heal. If we're just taking tonsillectomy as our simple example, I tell them this is going to really suck for 2 weeks, even 3 weeks, but it is going to be worth it for your life. Because I
Yeah.
promise you, when you're in your 20s and 30s, you are going to be 10 times more miserable and wish you had done this when you were younger. And so it's worth going through it. You take each day as a win, even if it's a struggle. And then overall, let's say it's recurrent tonsillitis. It's like your throat is constantly bothering you. You're constantly getting sick. You're missing so much school. You're on so many antibiotics. They need to have a buy-in. And
Yeah.
and
For
so those
sure.
are like my two extremes. And then there's the
Yeah.
middle.
Yeah. I love, our words as adults need to match the experience that kids are having. And if we are saying something that's so out of touch with what their reality is, like you told me this was going to be easy and it's not
Right.
easy at all, then that betrays the trust, as you said. And I think there's a way to prepare for action after the surgery, just thinking we're going to have these two types of medicine that you're going to have when you're all done, and mommy's going to give it to you every time you do it. You get to put a sticker on a chart. We're not promising ponies, but
Right.
we're saying there's an incentive there. And like your example you gave, like your job, kid, after this surgery is to take your medicine because
Right.
it's not going to feel good. And you're preparing your teens for that. I love that. I thank you for being a part of that conversation with families because sometimes it can feel like you're going in a little bit blind and there's a lot to take in on surgery day and it's hard to remember everything that day of surgery.
Right. No, it's true. And I mean, and our nurses go over it before they leave as well. So sometimes they're like, don't leave, don't leave. And I might have like 15 patients to take care of, but
Yes.
I know there's redundancy in the system. I know when I talk to them pre op, none of it is going to get absorbed at all because they're just anxious, the
Yeah.
parents. And so
Mm.
I know that conversation is going to happen post operatively with the
After
nurse.
too.
So I'm not worried that if they miss getting to ask me one question about post-op care and pain control, that is something we are, highly regulated in terms of what information we're giving. We have kind of a checklist, and
Yeah.
especially if there's any stronger pain medicine involved, how to give it safely and when to give it is something we really drill in.
And now a word from our amazing sponsors. We're so grateful to have Paineys Instant Topical Anesthetic Spray as our sponsor of today's podcast. Help control pediatric procedural pain associated with needle procedures and minor surgical procedures while improving patient satisfaction. Paineys Instant Topical Anesthetic Spray works immediately. It is a non-drug and non-flammable topical spray that can be used to temporarily relieve the pain associated with minor surgical procedures and needle procedures. Pain Ease is a medical device and does not contain medication. It can be a safe and effective alternative for lidocaine injections when used to temporarily control pain associated with immunizations, IV starts, blood draws, foreign body removals, and suturing or suture removal, to name a few. Paineys works on a 3-step process. First, prepare the site and equipment for the procedure per your facility's protocol. Second, apply Paineys by spraying about a can's distance away for 4 to 10 seconds or until the skin begins turning white. Finally, perform the procedure. The anesthetic effect of Paineys lasts about 1 minute and can be reapplied as many times as necessary. Refer to application instructions for full details. Important risk and safety information. Consult your pediatrician when using on children 4 years old and younger. Do not use on large areas of damaged skin, puncture wounds, animal bites, or serious wounds. Do not spray in eyes. Overspraying may cause frostbite. Freezing may alter skin pigmentation. Use caution when using product on persons with poor circulation. Apply only to intact oral mucous membranes. Do not use on genital mucous membranes. The thawing process may be painful and freezing may lower resistance to infection and delay healing. If skin irritation develops, discontinue use. Caution, federal law restricts this device to sale by or on the order of a licensed healthcare practitioner. Study suggests that pain ease does not induce vasoconstriction, does not contaminate a site that has been cleansed, and is preferred by patients and practitioners. Pain ease comes in 2 different spray pattern variations, medium stream and mist. It is also available in 2 sizes, 3.9 ounces or 1 ounce single patient. Gebauer appreciates the care and comfort that you provide to pediatric patients. Visit gebauer.com/pain ease with no space to learn how pain ease can make visits more comfortable. Tell us a little bit about your book and your purpose in writing it. And how did you sit down one day and say, I'm going to write a book, or how did it come up for you?
So I always like to say this first because it is really important. I was always a writer. So
Okay.
I'm not a doctor. Like and there's value to it too, but there's many doctors who are like, I've just had this like storied career. I should write about it. I think a lot of people think that. I was a passionate writer from the time I was 7 years old. And I used to staple together like pieces of loose leaf and pretend that I wrote a book from like adolescent age.
Wow.
But I needed the substance to write about. And then I obviously went all in on medicine for, 2 decades, basically. And then I after I had my third daughter, she was in the NICU for 2 months, and she was born really suddenly. I had, preeclampsia, and she was IUGR, and I went through this I went through, like, kind of the, blessed life period, and then I had a little bit of everything falling apart, but
Yeah.
meaning I had never been the patient. No one in my family had ever been sick, with anything really terrible. All of my grandparents were alive, kind of that setting. No
Yeah.
genetic or family diseases known about. And then suddenly I have this baby in the NICU. And then she came home okay. Thank God. She was like a feeder grower. And then a couple months later, my father discovered that he had a brain tumor and inoperable, well, not inoperable, but incurable. And then 2 weeks after that, I found that I had advanced breast cancer. So I'm not going to get into like the whole sob story of that. But the point is,
Wow.
that whole aftermath of the doctor becoming the patient spurred me to write my first book,
Mm.
which was called Hell and Back. And the reason I wrote that book was that I was having all these things happen and they seemed like stories. And also, I'm a storyteller. That's just my personality. I learn by storytelling. I'm a repeater because I like to hey, I'm going to tell you this whole story about this really complex case and I want to hear what your input is. And I mean, I will call for people that I am friends with, other pediatric ENTs, and run this case by them. And the reason it sticks with me is it becomes a story in my head.
Yeah.
But then here I am on the patient end of things, and the same situation was happening of how I was processing things. And I just kept thinking, if this crazy story is happening to me, it must happen to other women. And then it just started to transform into me writing down not just the story to tell the story, but the story with maybe like the ending or the solution. And eventually this becomes a book. And again, I wanted to be like the girlfriend's guide to breast cancer. It was supposed to be written in a way that you could like read it based on where you were, or if you were just in a waiting room in little
Yeah.
tiny pieces, or you could read it beginning to end if that's what you wanted to do, and
Yeah.
read it where you are.
Ah, okay. I see.
Okay. And what I really wanted to write about as time went on was like the patients and the
Yeah.
stories of my career. But I
Um,
needed to like live long
yeah.
enough
Yeah.
past this like horrible diagnosis. And I also needed, to get a decade under my belt that I had like the stories that are not only worthy of being told, because every story is, but
Yeah.
the ones that I chose were the ones that had a huge arc. Kind of what you're saying, the ones that were like the medical mysteries, the ones that took so many steps to like for the light to turn on or to
Mm,
get to the end
yeah.
that had something to teach because I
Yeah.
could just write, I could write 200 stories of just crazy things that happen as a physician or as an ENT surgeon. That's not the ones I chose. And then that wasn't enough because that's just a book of medical stories. I just realized that there are pearls of wisdom, whether worthy or not, that I'm always repeating myself to my trainees and my residents. And I started to think, do I have enough to make a book out of it? And each story had to have what are the takeaways and what is the value here? And so, again, all these things are swirling around in my head for years and years and years. And also, how do I de identify patients to completely protect them
Yeah.
from HIPAA enough to be able to write a story about them? Or can I only write about stories about patients that I have that deep, deep relationship with the families enough to call them up? I started talking about this 3 years ago with a surgeon friend of mine when I visited her in LA, picking people's brains of how do you do this? Like, I know there's tons of books out there, but I still don't get it. How did they do that? Did
Yeah.
they ask each of their patients? I just had this eureka moment about 2 years ago when I was in the shower, like, I got it.
It's always in the
I
shower.
it's always in the shower. That's like the only time us women can think without
Yeah.
like there's background noise. We can't hear the screaming and the barking.
Yes,
We're in our broiling hot comfort zone, and you're
exactly.
like, "Oh my god, I figured my life out," but like I don't have a pen to write it down because I'm in the shower.
It's
How
it.
many of us have jumped out of the shower, gotten water all over the bathroom floor, and found our phone and like furiously like type a voice memo or like a note in there?
I have for sure.
Yeah. So when I figured that out, this structure that I wanted to mirror the operating room where we have a formalized structure of like timeout, here's the backstory, then the event, which is the surgery, then a debrief, which we don't always do, but it's part of the structure. And
Yeah.
the debrief could be the lessons, the takeaway. What do you learn from this?
Wow.
And then the last part, which I added, which was like my finale of when I was like, I really should write this is, and what was the aftermath? How did this spill over into my personal life? It's very brutally honest and personal. And
Yeah.
when I got all of those elements, I started writing. And then there was like 2 more years after that.
Yeah. It's not a short process at all.
No. But what I wanted was this kind of duality of like inspiring the next generation to say like you got to be all in if you're going to do this. This is like might scare some people away. I mean in
Yeah.
the pre-med kind of aspiring to be a doctor realm, and
Right.
then also showing parents like a lot of books do talk about doctors with their struggles, like psychological struggles, suicidality, like when things go wrong. There are books like that out there, but this is more about like when you internalize these families and these patients so much that they become like part of the tapestry of your
Mm.
career and the lessons that you learn. And
That's
that really,
meaningful.
yeah, I mean, that those again, like some of the patients, they've already like done a shelfie with the book because they know it is inspired by them.
That's incredible. I think it probably gives a lot of I don't know, it feels good to know that as much as you impact me, that we impact you too in that
Yeah.
relationship, that it's a two-way street. And I think the more we can see that we're just two humans trying to do the best thing for this child here and the partnership, and that there are both good parts and bad parts on all different sides.
Advocating for your child is so important, but it shouldn't trample everybody around. I mean, there are other patients in the waiting room. And like you said, you're dealing with a
A
human that does have
1000%.
emotions.
Yeah, I think that, like, I just keep going back to, like, the honey and vinegar thing, is that
Right.
building a relationship with the provider and the care team is so important. And, I give this sticky note example because I hear that come up a lot with parents who have been through something really traumatic with their child. So one of them was a conversation that I had, and the the nurse handed her the bag and said, "Here, bag your child. Um, you're going to learn how to do this. You're going to have to learn how to save her life." And she was 2 months postpartum. It completely traumatized her. She said, ever since that experience, I just learned I need to stand up for myself. And I wasn't comfortable to bag my own child. And I had to say that. And she said, so I think I've got a sticky note on my chart now. And it's kind of that thing of where can we see where the other person is coming from and that we are two humans showing up? And that I mean, especially pediatricians, we're so lucky. You all chose this career because you want to make the world a better place and help kids and families. And everybody comes with their own experiences. I think there's that beautiful relationship that can be born, even if it starts off a little sour. You say, "Whew, okay, I was heated. That took a minute. Let me tell you what I'm really trying to say," and vice versa. The respect is so, so important between both parties.
I mean, listen, there are some parents. There's this one particular mom I'm thinking of. It took a lot to win her confidence.
Yeah.
And once I did, like, she'll follow me to the ends of the earth. So sometimes that's a win too. Like, I feel
Yeah.
really good. Like, now I know all these years later, I know that it took trust and time. And she was like a little bit of a hard ass and like,
Yeah.
so it's okay, like you said, to get there,
Yeah.
not always off the bat.
Yeah.
But
Yeah.
then once you realize this person is rooting for your kid and trying to help and listening to what you're saying, and you're making the decision to trust this person enough to have your child under anesthesia in their care,
Yeah.
then you got to let the guard down a little.
For sure. For sure. You want an expert, skilled person who knows their decision making, knows what they want to do. You want your child in the hands of that person. Mm.
The other thing I was going to say with what you just mentioned, when you go into the pediatric side of medicine, you have no idea that you're actually taking care of the family and the parents.
Yeah.
You learn that once you're out in practice.
Mm.
We choose it because we're like, children are amazing. We want to help children. We want to care for children. And we think we might be avoiding adults and caring for adults. And then you get out into the reality. And I come home and I tell my husband every single day, because he's not in medicine, but he's been with me for a long time. Like, it was all about the parents and the psychology and their relationship and whether they hate each other and they're divorced and they're angry, or whether they love each other, or whether I speak to one and then the other parent's like, you have to tell me all over again.
Mm. Yeah.
So there's so much that plays into it that's not about the pediatric specialty. But again, no one tells medical students or residents that.
Yes. Yes. And yes, they learn on the job for sure.
Yeah.
Where can people go get your book? Where can we find it? And I'm not going to let you get away without your favorite part of being a pediatric ENT surgeon, but I want to hear where we can get your book first.
Okay, thank you. Hopefully it is the easiest thing to find, because then I've done something right. So right now it is exclusively on Amazon's. It's called Breathless: Surgical Tales from the Brink and Back. And
Yeah.
so you can go on Instagram to, at Dr. Tali Lando, which is my name. I have a website that also has all the links, and I made it really easy because it's Dr. Tali Lando.
You did make it
um,
easy, and
I
I
did
for
try to
all of
make it
us
easy.
tired moms, we appreciate that.
And then you could always use Google, and ChatGPT and I talk a lot. And according to ChatGPT, I'm doing a really good job getting my book out there.
Love
So
it.
it should be findable that way as well. If you can't remember anything I just said, but you're like, medical memoir, Lando, I might
Breathless.
figure it out. Breathless. And breathless is because I guess it's not as self evident as I was hoping it would be, because people are still saying, why'd you call it breathless? But it's like, I'm an airway surgeon, and it's about, what is the opposite of making a child be able to breathe? It's when they're breathless, and that's when it's life or death. And, that is the stuff of life. Without, it's ABC: airway first, airway, breathing, then the heart and circulation. So breathless is like that emergency when the child is not breathing.
I love it. I feel like it should be the name of a medical drama
I know,
based on your
exactly.
book. Hint,
I'm
hint.
very excited at that idea. Hint,
I
hint, for
love that.
sure. I mean, I already see the episodes evolving, because I definitely was an obsessive and am an obsessive, medical drama watcher ever since I was, started with Grey's Anatomy freshman year of college.
Same, same. Okay, I'm going to change my question a little bit because one of my favorite things that I know, what we see in like the hospital is that the care team and providers know so much about families, right? Like we know where you live, we know who your insurance carrier, your medical history, and you don't really get to know a lot about the people taking care of you. So, Dr. Lando, I would love for you to tell us your favorite part about being a pediatric ENT surgeon, but also your favorite part of being a mom.
Okay, so favorite part about being a pediatric ENT surgeon is that kids are just unbelievable sometimes. I mean, they're clever. They can just blow you away with the way that they say things. I mean, one of my patients, if the mom ever listens to this, she'll know exactly who she is. She knows her ears hurt and bother her. So when she was like 2 years old, she was like, "Can you fix my ears? Can you put little tubies in there?" And she would call them her tubies, and it was like the cutest thing in the entire world.
Yes.
And so there's just things that just kill you. They're like
Yeah.
smart and insightful,
Yeah.
and they could be
Intuitive.
so brave and intuitive and ask all these amazing questions. And I'm still like enjoy those moments with kids. I mean, sometimes it's the opposite because I got to get my job done, and so I have to do invasive things that they don't like.
Yeah.
But I just like kids are just they could be just unbelievable. I still have so many moments in my day where I'm like, I'm just so super lucky. And then the other part of it, which is the much more surgical part, is you are like, it's all on you. I mean, you could just totally save this kid's life and they can go off to have a completely like the non-complex ones. And pediatric ENT has that mix of like really impactful problems that are routine for us, like not breathing at night or not hearing, and we can just solve it
Mm.
because this might be a completely otherwise healthy child. And then with the medically complex ones, we get to go through all the stages with them and really see them grow up and graduate in ways that you could never have imagined when they were on a ventilator as an X 24-week preemie.
Wow. Yeah.
Now, as a mom, I mean, my kids are, teenagers. And so it's so many emotions and so much psychology going on. But right now I am really loving how they are just living up to these amazing expectations. They grew up with a mom that was always busy and not home cooking and doing a lot of the house stuff. They don't have a fixed role perception. I think they have a lot of like whoever's better at the one thing, they do it, or whoever's around
Mhm.
more. No one's like in a box as to what it
Yeah.
is that they solve. They just have risen to the occasion with how crazy busy we are. That makes me realize that they really understand like what keeps me away from home.
Thank you for your sacrifice. There's been a lot of times that you've sacrificed time with your family to help other families. It's a good reminder for when you feel like you have to protect yourself against healthcare providers,
Hmm.
that they're there in the room with you to care for you. And if you just remember that as a parent every time you walk into a room with a provider, that might help a little bit, kind of set the stage of like, wow, this person sacrifices a lot to be here in front of me, to care for me. Let's start
Yeah.
there.
Yeah, I mean, you can always get a bad feeling from your interaction with a provider. It might be just the mood of the day or other stuff going on. But if you just don't click, you don't click, and that's okay. You
Okay.
don't want to force that relationship.
Yeah.
Because when I'm feeling that tension where I think I'm a pretty good gauge of people, but it's off and
Yeah.
we're not clicking, then okay, don't trust me to be the person that cares for your child. And there, you will find another person.
Mhm. Well, you are wonderful. Thank you for all the time you're giving us today and talking about how busy you are. We will absolutely look at your book, Breathless, and what your social media is, Dr. Tali Lando,
Yes.
Lando. And
Yes.
thank you for being with us today.
Thank you so much for having me.
For those of you who are joining us today, I am not a doctor. I'm not a therapist. I am a child life specialist. And the suggestions and tips and resources that I talk about with parents on this podcast may be great for you and they may not be right for you. So, the most important person you can talk to about getting support is your care team, your doctor who knows your story and your child's story. So, regardless of maybe what I mention or what other families mention here, we're not licensed therapists, we're not doctors. We're having a conversation about what the parenting journey has been like. So, please keep that in mind as you listen today.